Good afternoon, guys. I have discussion B for you. We're discussing we're discussing early stage Alzheimer's. Okay, for B. Here we go. Early stage Alzheimer's often begins not with a dramatic moment, but with a quiet drift, small lapses that feel explainable, excusable, or just getting old. Yet beneath those moments is a pattern. The brain is working hard to do what once came effortlessly. What makes these symptoms distinct is that they interfere with daily life, repeat, and progress. And the person experiencing them often cannot see the change clearly, even as those around them do. Below is a deeper, more textured portrait of the early mild dementia stage. What clinicians look for, what families notice, and how these changes unfold in real life. Core early stage Alzheimer's symptoms, mild mild dementia stage, memory loss for recent events. This is the signature early symptom. The person forgets conversations from earlier in the day, repeats questions, misses appointments, or becomes dependent on reminders. Long ago memories remain intact, which can create the illusion that everything is fine, even as the present slips away. Difficulty finding words. Speech becomes effortful. They pause mid sentence, substitute vague words, that thing, that place, or abandon a thought entirely. Over time, conversations become shorter, not because they not because they have nothing to say, but because receiving language is exhausting, or retrieving language is exhausting. Trouble with planning or problem solving, multi step tasks, cooking a meal, organizing bills, planning a trip become confusing. A once meticulous person may make uncharacteristic financial mistakes or struggle to follow a familiar recipe. Challenges competing challenges completing familiar tasks. Activities that once were automatic now require conscious efforts. Logging into a computer, using a TV remote, or driving a routine route may suddenly feel unfamiliar. Some people began avoiding these tasks to hide their difficulty. Losing items and not retracing steps. Objects end up in improbable places. Keys in the refrigerator, glasses in a shoe. The person cannot retrace their steps, and many accuse others of moving or stealing items, a sign of impaired memory rather than intent. Confusion about time or place. They may lose track of dates, seasons, or the flow of time. A person might think it's morning when it's evening, become disoriented in a familiar neighborhood, reduced judgment, vulnerability increases. They may they may fall, or they may fall for scams, dress inappropriately for the weather, or eat spoiled food. Decision making becomes inconsistent, especially around finances and safety, changes in mood or personality, anxiety, anxiety, irritability, suspicion, or fearfulness may emerge. A once social person may withdraw, sensing that conversations are harder to follow. Others become unusually passive or dependent, decrease decrease intuitive hobbies, projects, and social activities lose their spark. This isn't laziness, it's the brain struggling to initiate and sequence tasks. Subtle visual spatial problems, difficulty judging distance, navigating stairs, reading or parking a car. These changes stem from the brain's processing not the eyes, and can be mistaken for vision problems. How early Alzheimer's differs from normal aging. Normal normal aging brings occasional forgetfulness. Early Alzheimer's brings patterns, repeated, progressive, disruptive. Normal aging, misplacing items but finding them after searching, forgetting a name but recalling it later, needing help with new technology. Early Alzheimer's, forgetting information that was once forgetting information that was just learned asking the same question repeatedly, getting lost in familiar places, noticeable decline in planning, organization, or word finding, changes that others observe, even if the person does not. The difference is not the presence of forgetfulness, but the frequency, impact, and trajectory. A professional evaluation is important when symptoms are progressive, worsening over months or years, interfering with daily life, safety, finances, medications, driving, noticed by others, especially if the person minimizes or denies the changes. Early evaluation matters because many reversible conditions can, can mimic dementia, thyroid disorders, vitamin 12 B12 deficiency, sleep apnea, depression, medication effects, and infections. Identifying these can identifying these early can prevent unnecessary decline. Okay, guys, here's the second part of B. Okay, this one talks about MCI. Okay, mild cognitive impairment. That's what MCI stands for, folks. Here's here's a way to explain MCI progression to families that is honest, compassionate, and clear. Something you can use in clinic, family meetings, or community education. It frames the transition in human terms, not medical jargon, while still grounding families in what matters clinically. Explaining MCI progression to families, a narrative you can use verbatim to adapt. Okay, folks, now I'm going to get into mild cognitive impairment for those folks that don't understand what that is. I'm going to add that to today's discussion. Okay, so here we go. When someone has mild cognitive impairment or MCI, it means they're having more memory or thinking problems that we can or that we would expect for age, but they still are able to live independently. They can manage their medications, pay their bills, cook meals, and get where they need to go. They may need a little more time or a few more reminders, but they still they're still steering their own life. Progression happens when these thinking changes begin to spill over into daily life. That's the moment when MCI starts to look like more like early Alzheimer's disease. The three things families usually notice. Tasks that used to be easy become confusing. A person who once handled the finances may start missing payments or making errors. Cooking a familiar recipe becomes overwhelming. They may avoid tasks they use to do confidently. Memory slips become more frequent and more disruptive. They forget conversations from earlier in the day, repeat questions, or lose track of appointments, even with even with reminders. It's not occasional forget. It's not occasional forgetfulness. It's a pattern. Insight starts to fade. People with stable MCI usually know something is wrong. As progression begins, they may say, I'm fine, even when they're struggling. This isn't denial, it's part of the disease. How to help families understand this shift. Families often ask, how will we know when it's getting worse? The simplest answer is you'll see changes in what they can do, not just what they can remember. Here's how to explain that. Independence is the driving line, dividing line. When someone begins needing help with bills, medications, shopping, cooking, or driving, that's a sign the brain changes are affecting daily life. Safety becomes a concern. Leaving the stove on, getting lost, falling for scams, or mixing up medications are red flags that MCI is progressing. Personality or behavior shifts, new irritability, anxiety, suspicion, suspicion, or withdrawal from social activities can signal that the brain is working harder and suggesting more and struggling more. A family friendly metaphor. Families often find this metaphor grounding. MC is like a car that is starting to have trouble with the engine, but still drives. Progression is when the car begins to stall, drift, or need something else to take the wheel, or someone else to take the wheel. It helps them understand that the issue isn't just memory, it's the ability to navigate life. What progression what progression doesn't what progression doesn't mean. It doesn't mean the person is suddenly incapable. It doesn't mean it doesn't mean they're no longer themselves. It doesn't mean families must take over everything at once. progression usually Progression is usually gradual, and families can adapt by step by adapt step by step. What families can do right now: starting start sharing tasks, finances, medications, transportation, simplify routines, consent, consistent schedules, labeled drawers, pill organizers, increase supervision gently, not as a control, but as a partnership. Mo- uh, Monitor safety, stove use, driving, wandering risk. Keep the person engaged, social connection, movement, meaningful activities. Families Families often feel relieved when they understand that progression is not a failure. It's a predictable part of the condition, and there are ways to support the person at every stage. Okay, guys, that's your B. I will be back on with C shortly. Give me a bit for a little break, please, and I will be back on with C shortly. For now, Gator Wellness, take care, folks.